All right, so to continue the series, we are talking about trauma responses. And today I'm talking about the kind of the opposite of what I have been talking about, which is a lot of trauma responses where people will forget things or they'll repress the memories, repress the emotions, those kinds of things. So this is kind of on the other end of the spectrum of trauma responses, which is ruminating on the event and rethinking about it over and over again. And it's almost like your brain is trying to make sense of what's happened. It's like your brain's trying to collect additional information, or at least with the information it has, is trying to put the pieces of the puzzle together, both emotionally and mentally, to be able to make sense of what's happened. So that's really big, important part of understanding this type of trauma response. Along with ruminating and rethinking about the traumatic event is nightmares. These are a lot of, you've probably heard a lot of these PTSD type of symptoms. Nightmares, flashbacks, and fear and anxiety. So, this is where your brain is hyper aware and hyper focused on the event. So instead of repression, instead of forgetting, it's the totally opposite. It's, hey, I remembered the exact detail of this situation and I just will not allow myself to go there because I remember that this thing happened there. And so I'm already having fear and anxiety when it comes to that event. So I've talked to a lot of clients who've been in car accidents, motorcycle accidents, things like that, where they will remember exactly where the accident took place, and they will avoid even entire sections of cities where they will just not go anywhere near that because they already start, their subconscious is picking up, hey, you're thinking about driving over there. Nope, I don't think so, man. You're not going to do that. So stay home, don't go. And so just the anxieties, your subconscious is already just like an hyper alert awareness focused on the event. And I mean, that's just as detrimental to your ability to function than anything, if you think about it. So you're not even wanting to go to some of these places. You won't go to some of these places. People that, have almost drowned or whatever, they won't even touch water for a while. Well, I mean, they'll take showers, hopefully. So, those kind of things, right? Like, it's just, they won't go anywhere near even the perception of any kind of those types of events. So, and it doesn't even have to be them that went through it. So, as you know, with PTSD symptoms, you can just observe or even sometimes hear about an event that happened to somebody that you care about or whatever, and you can develop those same types of levels of fear and anxiety, nightmares, rumination, and just sometimes even when you hear things that are traumatic in nature, that's sometimes worse because your brain and your mind can take it to whole other levels of trauma that aren't even there. They're not even part of your reality. So you can make stuff up in your head that, about plane crashes or whatever, and how it would happen and, what it would look like and what you would do. And so your brain is just picking out all these details about these kinds of things, even just when you hear about it. So it's really fascinating. I mean, it's interesting. It's not fun. I mean, I'm not trying to make light of anybody that, is dealing with this kind of stuff because it would be really horrible. But, the nightmares and the fear, the anxiety, and just the rumination, just the constant thinking about the event, puts your body in the fight or flight mode, response. And it's just like you get to a point where, like, how do you function when you're having all of those kinds of symptoms? So, if you're experiencing those kinds of things, you really, really, really need to, obviously, a lot of things that I've already talked about, with meditation and being able to calm yourself down and being able to take control of your thoughts. One of the things about meditation that's so important that people don't understand is it's not you're just sitting there, like Buddha or whatever, just, thinking about everything's, gummy bears and rainbows. You're trying to literally focus on your thoughts and control them so that they don't control you. So, anyways, that's just one. And go talk to somebody. Go talk to get some. Go to therapy. Honestly, if you're to that point where your anxiety's that bad, and your fear, and you can't sleep, and you're having nightmares, and I mean, these are major PTSD symptoms that we're talking about, guys. So, anyways, let me know what your guys' thoughts are about this, if you've experienced these kinds of things, and what did you do to try to cope with them? So, we would be all interested in knowing how that went down. Thank you.